Welcome to possiblemedicowallah.
Today we are going to study routes of drug administration. Before that, we are going to understand routes of drug administration briefly. I'll give you a simple example to clarify your basic concept on this topic. Imagine a person is in sick. He either gone to consult a doctor or a pharmacy store to bring the medicine. His first job is to take the medicine by appropriate route, which may include oral or injection. This is known as the routes of drug administration. The reference book definition is a route of drug administration is the path by which a drug or medicine or any other substance is taken into the body. Drug and patient related factors determine the selection of routes for drug administration. Route of administration depends on several factors like physical and chemical properties of drug. Under the physical properties of drug, it can be a solid, liquid or gas. Under the chemical properties of drug, solubility, pH, stability and irritancy. Go through the link which was given in the description for more details and you can refer I button. Second factor is routine treatment or emergency and condition of the patient. Drug administration depend upon a patient condition. That means like if patient is unconscious or in an emergency condition, basically we administer the drug by injectables. If not in emergency condition, that time we administer the drug by orally. Mostly we prefer the above mentioned routes. Apart from that, several routes of administration which we further discuss. Third factor is effect of the digestive juice and fast metabolism on the drug. Gastric juice significantly impair the oral route of administration by affecting the solubility and stability of a drug due to its acidic pH, potentially reducing the amount of drug absorbed into the bloodstream, especially for the drugs that are sensitive to acidity. Therefore, some medication may need to be administered by a different route if they are significantly affected by gastric juice. Fourth factor is patient and doctor choice. Sometimes route of administration of the drug depend upon a patient and doctor choice. Apart from the above mentioned routes, we will discuss now various types of route of administration. Let's see classification of the route of administration based on their location. Location means their special place. According to that, routes of administration are divided into two types. One is local route, second one is a systematic route. Today we are going to focus on the local route of drug administration. Local route. Local route is a simple route in which drug is directly applied on particular area or directly on site of action. For example, if a patient got skin rashes on hand, then that time patient will apply medicated ointment where rashes are present, not any other part like leg, face. Okay. So under the local route of drug administration, we are going to study topical route, nasal route, vaginal route, urethral route, rectum and anal colon route, auricular route, intraarterial route, and deeper tissue route. So first we will see the topical route. Topical route. In this route, drug is applied on external surface of skin for localized action. In this route, various types of formulation are lotion, ointment, cream, powder, spray, and etc. we are using. Example: antiseptic and healing ointment. Advantage in topical route is applied for local action, painless, safe, cheap, and useful for children. Disadvantage is slow action and some drugs cause irritation. Second route is the nasal route. In this route, drug is inhaled through mouth or nose for their action. Advantage of this route is it given a rapid absorption and effects. Example is as a inhalation, salbutamol, ipratropium bromide are used for bronchial asthma and chronic obstructive pulmonary disease treatment. Comes to the third route is vaginal route. Drug administration by the vagina for action of their drug. Drug administration as tablet, cream, pessary for treatment of the vaginal candidiasis. Fourth route is the urethral route. Drug administration by urethra. Drug administration as jelly. Example lignocaine. Fifth route is the rectum and anal canal. In this route, drug is injected to the rectum and anal canal for their local action. Example is suppositories, administration of the drug in solid form into the rectum, and another one is enema. Enema is administration of drug into the rectum in liquid form. This is the key basic difference between the suppositories and enema. Suppository we are giving in the solid form and enema we are giving in the liquid form. Advantage of this route is we can give the drug to unconscious patient. Disadvantage of this route is it can cause irritation, so it is not a well accepted route. Sixth route is auricular route. In this route, drug administration into eye, ear, and produce local action. Drug administration as an ear suppository, drops, ointment, and spray for infection and allergy condition. Example: gentamicin eye and ear drops. Seventh route is intra-arterial route. In this route, drug directly injected into artery by needle or syringe. This route is rarely employed. It is mainly used during diagnostic studies such as coronary angiography and for the administration of some anti-cancer drug. Example is for treatment of malignancy involving lips. Eighth route and last route under the local route is depot tissue route. In this, drug is administration into deep tissue by injection and syringe. Depot tissue is divided into three types: intra-articular, intrathecal, and retrobulbar. In the intra-articular route, drug is injected into knee joint. Dose is larger dose is 40 mg and smaller dose is 5 to 10 mg. Example is hydrocortisone. In the intrathecal route, drug is injected into CSF and dose is less than 20 ml. Example is lidocaine. In the retrobulbar route, drug is injected into behind the eyeball. Dose is 2 to 3.5 ml. Example is anesthesia. That's all about the today lecture. We given the note in the descriptions box. You can refer from there. And we will study the systematic route in the next lecture. Thank you. Have a nice day.
Don't forget. Like, share, subscribe. Thank you for watching.